Today, we will be discussing mental health issues in the workplace. It is not an excuse. Mental health is real, and we need to bring awareness in the workplace. I chose this picture because, as an employee or an employer, sometimes we go to work every day with a smile on our face when in reality, that's not how we feel. Sometimes our work is overwhelming and we're doing everything we can to get by with a little support. Mental health defined. Mental health is a state of well being and is essential for overall health. The Australian Department for Public Health described it as our ability to respond to the challenges that life throws at us. Mental struggles can be related to money, work, relationships, family, health, or everyday life. To have good mental health is to have the ability to bounce back from our struggles we face and move forward. So, when does mental health start to become a problem? Sometimes our struggles are bigger than what we can deal with alone, and we need additional support in order to move forward. We may need to seek help by mental health professionals, friends, family, and work. Noticing the signs is a huge step because some people may not realize they're struggling with mental health issues. People may also be scared to talk about it as there is a stigma behind mental health. If an employer notices the signs, they can take action to help the employee. Altered physical appearances in a person may be as simple as having difficulty keeping up with their appearance. Someone who used to come into work always dressed up with a positive attitude now comes into work with tired, with poor hygiene, and may dress inappropriately. Their mood shifts from positive to negative. They're easily angered and frustrated. This is due to an increase in stress and anxiety. An employee may have a decreased work performance for many reasons, which may make it harder to stay focused and productive. Someone who is experiencing mental health issues will experience a difference in eating and sleep patterns. If an employee doesn't take lunch, this may be a sign that they're experiencing mental health issues. Depending on the person, one may have insomnia or sleep too much. This is something that happens behind closed doors but is often noticed in someone's appearance. The amount of pressure someone faces in the workforce can give someone a lot of anxiety. If someone is more anxious than normal or paranoid, this can be a sign of mental health illness. An employee that is taking an unusual amount of time off may be experiencing mental health issues. Mental health days are a thing, and sometimes people need a day off when they're suffering from a mental illness in order to help improve their mental health. Whenever someone is experiencing mental health issues, they may be likely to turn to alcohol, drugs, or substances. If you think that a coworker or an employee is misusing substances, that is a more urgent sign that a person needs help. All this information can be found on Discovery Mood and Anxiety Program's website, discoverymood.com. Several major causes of mental health issues in the workplace is limited support by coworkers and employers, inadequate pay, a toxic environment, and an excessive workload. Let's look over the picture limited support. There's a lot going on in this photo. I see a father who is trying to get his work done while taking care of two small children. I also see a father who may lack support in his personal life but is giving the support from his employer to work at home. When people look for jobs, they are looking for employers who support them. Common supports are flexible work hours, a workplace that respects time off, and remote work, such as the dad in the photo. All of these supports tie into mental health. When an employee is not supported, it can lead to employees being overwhelmed and unmotivated. Moving on to inadequate pay. This picture depicts a deep meaning, showing that employers are underpaying their employees and expect their employees to be happy. It doesn't work this way. In fact, the American Psychological Association's Work and Wellbeing Survey in 2022 showed that 2 in 5 employees advised openness to pursue other job opportunities and had a desire to quit their current job. Employees feel their pay does not reflect the rise in inflation, and they do not receive adequate pay for the work they do. The working class has constant pressure to pay bills and provide for their families, which can lead to mental health issues such as depression and anxiety. A toxic work environment is a place that enables negative behavior. Looking at the picture above, you notice fingers are pointed and the employee is feeling down. When you're in an environment that is constantly negative, everything seems to be an issue and you're feeling left unappreciated, it can mentally weigh you down. This type of environment can lead to mental health issues, including anxiety, depression, and added stress. An excessive workload can look like this picture. The phone is constantly ringing. Emails never end. Deadlines, to-do lists, other staff handing more work on top of what she's already working on. Speaking from experience, this type of workload causes stress and burnout. Burnout happens when someone becomes exhausted. It becomes a barrier for employees to do efficient work. Employees are held with high expectations, and the constant pressure to perform well may be unreasonable. Unfortunately, burnout will lead to an employee resigning. I wanted to dig deeper into the topic of toxic workplace environments. People may be in a toxic environment and be unaware. I think it's important to know what toxicity looks like in the workplace and for people to realize that this type of environment is not normal or okay. Working 24/7, being micromanaged, working overtime, being expected to respond instantly to requests, working without breaks, gender stereotypes, having pointless benefits, being expected to drop everything to achieve results, and viewing performance busyness as a status symbol. Arguably, arguably, some people believe that using mental health issues is an excuse for employees to not do work. The belief is that people use their mental illness to call into work when it's not needed, to be angry towards another person, or miss out on meetings. Having a mental illness can't be faked. If someone is using them, and they're not excuses, but more likely a cry for help. According to the CDC, 40% of people living with severe depression are not receiving any treatment. So, how do we make it better? What is our call to action? First, the workplace must support people with mental health disorders. Recognize the signs and offer trainings. Implement mental health assessment tools. These come in the forms of checklists, quizzes, and questionnaires. These tools are beneficial for the person needing support and can provide feedback to employers. Implement a free employee assistance program. This type of program should be available to help people with any issues they're facing in their personal or work life. In summary, mental health conditions are real and affect real people. Poor working conditions lead to a decline in mental health. Mental health is not an excuse, but a cry for help, and employers should take necessary steps to support employees with mental health conditions. Otherwise, employees will exit and find another employee who will support them.